performing. Skill number 21 provides perineal care for a female. First thing I'm going to do is knock on the door. Hi, my name is Carolyn. Can I come in? Hi. What would you like to be called? Anna. Hi, Anna. I'm going to provide perineal care, also called pericare. I am going to make sure that your call light is within reach. I'm going to place that in your hand. I'm going to make sure your bed is low, Anna, and the brakes are locked. And I'm going to provide privacy. Anna, I will be right back. I need to go grab some supplies. You will need a basin. You will need soap. And you will need a protective pad. And you will need 6 washcloths. You will need 1 to wash the front, rinse the front, dry the front. 1 to wash the back, rinse the back, and dry the back. Okay? And Anna, I'm going to go get some water, and I'm going to test that water. Water, get it a nice warm temperature, and I'm testing it. And I'm going to add some water. Make sure it's comfortable for her. Anna, would you mind testing this water? How does that feel? Okay. Alrighty. We're going to go ahead and get started. I am going to put on my gloves. And Anna, I am going to expose you to put that protective pad under you, but I'm not going to expose you too much, okay? You can use this protective pad or a towel. I'm going to use this one just so I can demonstrate that for you. I am going to uncover you, Anna, just down to your knees and uncover you up here with your gown, okay? And I am going to put this protective pad under you. And again, remember, you can use a towel too. You want to roll that in and place that under her hips. Anna, on a count of 3, can you lift up? Now, if Anna can't lift up, you need to roll her from side to side, but she can lift up. You want to center that. You want to bring that other part through. Making sure it's under her hips and she's not overly exposed. Okay? Then we want to get our washcloth, the first one, and we want to wet it. And we are going to be cleaning her private area, and we're going to be going from front to back. So we're going to add some soap. Make sure there's soap in them. So we are going to touch you, Anna. I'm going to hold up here, and I'm going to be wiping from front to back, never this way. So we're going to hold here, and we're going to wipe down 1. We're going to flip that washcloth to a clean area. Holding there again, wipe 2. Flip to another area. And 3. Changing the washcloth each time. And we're going to get rid of that. We're going to put that in the laundry. We're going to get a clean one to rinse that soap off. Same method from front to back. Using a clean area for each stroke. So first one, wipe down 1. Flip that area to a clean area. And down 2. Flip it again. And down 3. Okay, and that was from front to back. Get rid of that, put that in the linen, and we're going to dry. We're going to, same thing, front to back. Going to pat her all the way down. All right, we have dried the front. Now, Anna, we're going to have you roll over so we can clean the back, okay? So we're going to go from shoulder and hip, and we're going to roll her on 3. 1, 2, 3. She rolls over. We can position the mannequin by bringing her hips back and letting her rest on her knee. Remember, don't overly expose her. So if you need to readjust the blankets in her gown, do that. only to expose her bottom. Make a little lather. And we're gonna remember, we're gonna wipe from front to back, never this way. So we're gonna wipe 1, flip that washcloth, 2, flip that washcloth, and 3, okay? Put that one in the dirty linen. Get a rinse one, same thing. Fold that in 4s. We're gonna go 1 front to back, 2 front to back, and 3 front to back. You doing okay, Anna? Yes. Get rid of that one. Now we need to dry. You don't necessarily have to fold this one, but we're gonna pat, 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 pat. Put that in the dirty linen. Now, very important, you remove this under pad, because if you don't, she's laying on wet material. So when you see it, remove it. And I'm gonna have you roll back, shoulder and hip on the count of 3. 1, 2, 3. She rolls back, adjust her, take this linen protector out as you see it. Don't contaminate it, don't get it on your clothes. Throw that in the trash. Adjust your patient. Anna, we're gonna get you all adjusted. And I'm gonna make sure you have your call light in your hand. Your bed is down low. Anna, I'm gonna go get rid of the supplies. I'll be right back. In the designated area, dump our basin, rinse it, and dry it. Put that in the designated dirty area. Remove your gloves. Wash your hands for 20 seconds. Hi, Anna. I'm going to make sure you have your call light. Your bed is still low. Your brakes are still locked. I'm going to remove my privacy. And my skill is complete. You got to make sure when you put that protective pad under her, remember to protect the bed so it don't get wet. You cannot leave it under her when you're done. It's wet and she's laying on wet linen. So when you get ready to roll her over after you've done the back, you see that protective pad, you take it. Don't cover her up with that blanket yet, because if you don't see it, you're not going to remember it. And then the other thing you need to remember in this skill is to make sure you don't overly expose her. You just need the area you're cleaning. So keep that sheet and that gown down to the hip area and the sheet to the knee area. When you roll her over, adjust that sheet again. Adjust that gown again. Don't overly expose her.